Hello everyone, I am Afreen and welcome to today's lecture. Today my topic is going to be about addiction. My topic will be covering the following 9 major objectives which will improve your understanding of addiction, models of addiction, why people take drugs, continued drug abuse as a voluntary behavior, reasons for why do some people become addicted to drugs while others do not, adolescence as a critical time for preventing drug addiction, drugs and human brain, addiction and health, and last, treatment and recovery of addiction. So, let us start with what addiction is. According to definitions, addiction is a recurrent chronic brain condition that is characterized by obsessive drug seeking and use despite negative effects. Drugs alter the brain's structure and function, which is why it is regarded as a brain disorder. These brain alterations may persist a long time and contribute to the negative traits of drug users. Addiction is a condition in which using alcohol or other drugs results in psychological or physical dependence or both. The term is frequently used as a synonym for substance dependence and is occasionally used to refer to behavioral illnesses such as addictions to gambling, the internet, and sexual activity. Similar to other illnesses like heart disease, addiction is a sickness. Both have major negative effects, are avoidable and treatable, impair the underlying organs' normal, healthy functioning, and, if untreated, can last a lifetime. Addiction and drug abuse have negative effects on people of all ages, including babies, adolescents, adults, and parents. Let us talk about negative effects on babies first. Drug-exposed fetuses run the risk of having underweight and preterm babies. The exposure may retard a child's intellectual growth and have a lasting impact on behavior. And adolescents who take drugs frequently engage in disruptive behavior, perform poorly in school, and quit out. Unplanned pregnancies, violence, and infectious diseases are all risks for them. And when it comes to adults, adult drug users frequently struggle with memory loss, concentration, and clear thinking. Due to their drug usage, they frequently exhibit poor social skills, which affects both their employment and personal relationships. And lastly, parents. Drug misuse frequently results in disorderly, stressful homes, as well as child maltreatment and neglect. Such circumstances are detrimental to the health and development of children at home and may pave the way for drug dependence in future generations. Now let us talk about models of addiction. The first model is the disease model or biomedical model of addiction. According to this paradigm, addiction is a chronic disease with biological and environmental causes. The traditional biomedical model of disease only requires the existence of an abnormal condition that causes discomfort, dysfunction, or distress in the affected individual. It also considers the possibility that this abnormal condition may be caused by biological, psychological, or social causes, even if these are still poorly understood. According to the biomedical disease model, the disease state is ultimately caused by a factor, such as the substance consumed, the person's inherent traits, or a mix of both. By focusing more on the inborn qualities of the individual, disease models developed in the 20th century expanded the initial idea that addictive behaviors were diseases. The fact that not everyone exposed to a substance develops a dependence on it, it is a drawback of the simple biomedical model, which stresses the significance of addictive behaviors in the development of dependence. The second one is social learning theory. The extent to which the behavioral characteristics of addiction occur and evolve within a social setting has been explained by this theory. According to the social learning theory, addictive behaviors are learned behaviors that can be brought on by social and environmental triggers. For example, the desire that smokers may have to smoke a cigarette when they enter a bar that has been associated with cigarette smoking in the past. Addiction-related behaviors are no different from other learned and habitual behaviors in this regard, even though the use of a particular substance may lead to very intense learning processes. Biomedical models which highlight the roles for the substance, the traits of the human, and the setting within which these occur now incorporate this role for learning processes and give rise to learned associations and habits. The third model is neurobiological models of addiction. These theories emphasize how the central nervous system and activity in particular neurotransmitter pathways play a role in understanding addiction. With the function of the dopamine pathway being highlighted here, changes in the activity of these pathways brought on by prolonged drug use are regarded to represent the disease at the root of addictive behaviors. A biomedical understanding of addictive behaviors as an illness is a major tenet of neurobiological models. According to current thinking, individual differences in the sensitivity and activity of these important neurotransmitter pathways account for the majority of the variation in how susceptible different people are to drug addiction. Modern neurobiological theories of addiction emphasize how addictive substances like heroin, cocaine, alcohol, nicotine, and others can strongly activate certain brain pathways related to motivation and reward. Next are social models and behavioral models. These addiction theories highlight the part habit plays in addictive behaviors, which are said to be acquired in accordance with the ideas of social learning theory. These models place much more emphasis on the role of interpersonal and social factors like peer influences and observational learning, as well as interpersonal factors like self-esteem, coping behaviors, and attributional style in the development of addictive behaviors. They do not necessarily discount the significance of neurobiological models in explaining some of these processes. According to the social learning theory, behaviors like substance use and addiction develop through a process of behavioral acquisition and reinforcement that is fueled by operant and classical conditioning mechanisms. These ideas have developed from straightforward theories of classical and operant training that emphasize interactions between personal dispositions and environmental situations. Now a question arises, which is, why do people take drugs? In general, people begin taking drugs for a variety of reasons. Very first reason is to feel good. Most medications that are abused result in strong pleasurable experiences. Following the first feeling of pleasure, various effects follow that vary depending on the drug consumed. For instance, the high form stimulants like cocaine are followed by emotions of strength, self-assurance, and greater energy. Opiates like heroin, however, generate euphoria that is followed by feelings of relaxation and fulfillment. Another reason is to feel better. Some people start misusing drugs in an effort to cope with their distress when they have social anxiety, stress-related disorders, or depression. In people suffering from addiction, stress can be a significant factor in initiating drug usage, maintaining drug abuse, or relapsing. Third reason is to do better. Some people experience pressure to chemically alter or boost their athletic or cognitive performance, which may contribute to early experimentation and ongoing drug addiction of substances like prescription stimulants or anabolic androgenic steroids. And another reason is curiosity and because others are doing it. Teenagers are especially at risk in this regard due to peer pressure's powerful influence. Teenagers are more inclined than adults to act recklessly or courageously in order to impress their friends and demonstrate their independence from parental and social expectations. Now we can think of, if taking drugs makes people feel good or better, what's the problem? People may initially experience sensations that appear pleasant and may also think they have control over their drug use. But narcotics have the power to completely take over a person's life. If drug usage is continued, other enjoyable activities eventually become less enjoyable, and the person eventually needs to use the drug just to feel normal. As a result, they might obsessively seek out and use drugs, even though doing so puts their loved ones and themselves in grave danger. Even at the beginning phases of drug usage, some people may start to feel the desire to take higher or more frequent amounts. These are the obvious symptoms of addiction. Drug use is risky, even in relatively moderate amounts. Consider how a sociable drinker can become intoxicated, get behind the wheel of a car, and quickly turn a pleasurable activity into a tragedy that affects many lives. Now let us talk about continued drug abuse as a voluntary behavior. Usually choosing to use drugs is a voluntary decision at first. However, persistent usage can substantially weaken one's ability to exercise self-control. This lack of self-control is a defining characteristic of addiction. Studies on brain imaging in addicts reveal physical alterations in brain regions important for judgment, decision-making, learning, and memory and behavior control. Scientists think that these modifications affect how the brain functions and may provide an explanation for the addictive behaviors that are compulsive and destructive. Moving to another objective of my topic, which is reasons for why do some people become addicted to drugs while others do not. As with any disease, each person has a different level of susceptibility to addiction, and no one characteristic alone can predict whether a person would develop a drug addiction. In general, a person has a higher likelihood of developing drug abuse and addiction the more risk factors they have. On the other side, protective variables lower a person's likelihood of becoming addicted. Risk and protective factors may be either environmental, such as conditions at home, at school, and in the neighborhood, or biological, for instance, a person's genes, their stage of development, and even their gender or ethnicity. Let us discuss environmental factors that increase the risk of addiction in detail. First environmental factor is home and family. A significant component is the impact of the home environment, particularly throughout childhood. Children's chances of having drug issues are increased when their parents or other older family members abuse alcohol, drugs, or act criminally. Second environmental factor that increases the risk of addiction is peer and school. During adolescence, friends and acquaintances can exert a growing amount of influence. Even people without risk factors may be persuaded to use drugs for the first time by using their drug-using peers. A child's likelihood of using or developing a drug addiction may increase if they perform poorly in school or have poor social skills. Now, let us discuss biological factors that increase the risk of addiction. In addition to the influence of environmental circumstances on the function and expression of a person's genes, scientists believe that hereditary factors account for between 40 and 60% of a person's vulnerability to addiction. The developmental stage of the individual and any additional medical issues may have been influencing factors. Compared to the general population, adolescents and those with mental illnesses are more likely to abuse and get addicted to drugs. Some other factors that increase the risk of addiction are early use. Although using drugs at any age can result in addiction, evidence indicates that the earlier a person starts using drugs, the greater the likelihood that major issues will arise. This could be due to a combination of early social and biological sensitivity factors, such as poor family connections, exposure to physical or sexual abuse, hereditary susceptibility, or mental illness, as well as the damaging effects that drugs may have on the developing brain. However, it is still true that early use is a powerful predictor of future issues, including addiction. Another is method of administration. It also increases the risk of addiction. A drug's potential for addiction is increased when it is smoked or injected into a vein. Drugs taken orally or intravenously both quickly enter the brain and cause a strong rush of pleasure. This potent high can, however, quickly wear off and bring the abuser back to lower, more normal levels. According to scientists, some people take drugs repeatedly in an effort to recreate the transient euphoric experience because of this striking contrast. Now, let me bring your attention to another objective of my topic, which is adolescence as a critical time for preventing drug addiction. Early drug usage, as previously mentioned, raises a person's risk of becoming addicted. Drugs alter brain chemistry, which can result in addiction and other severe issues. Therefore, lowering these risks may be significantly aided by avoiding drug and alcohol use in adolescence. Drug addiction can be avoided if we can stop young people from experimenting with drugs. Drug misuse is significantly more likely to occur during transitional periods. Drug misuse may result after a divorce or job loss for an adult, while moving or changing schools for a teenager might be risky situations. Children who move from elementary to middle school in the early stages of puberty encounter novel and difficult social and scholastic circumstances. Children frequently experience addictive substances like cigarettes and alcohol for the first time around this time. Teenagers may experience increased drug availability, drug usage by older teens, and drug-related social activities when they start high school. The desire to try new things or take bigger risks, for example, are characteristics that are common among developing children and may increase teens' propensity to experiment with drugs. Some teenagers could succumb to peer pressure to participate in drug use with them. Others could believe that consuming drugs like steroids will enhance their physical appearance or athletic performance, or that abusing alcohol or methylene deoxymethamphetamine will make them feel better in social situations. Teenagers are increasingly taking prescribed ADHD stimulants like Adderall to aid in their academic performance or weight loss. Teens' still evolving judgment and decision-making abilities may make it difficult for them to appropriately appraise the hazards associated with any of these drug usage scenarios. At this age, using addictive substances can impair brain activity in regions crucial for motivation, memory, learning, judgment, and behavior control. Therefore, it should not come as a surprise that youths who use alcohol and other drugs frequently experience familial and social issues, poor academic performance, health-related issues, and contact with the juvenile justice system. Now, let us move forward to another objective, which is drugs and the human brain. The most intricate organ in the human body is the brain. All human activity revolves around this 3-pound mass of grey and white matter. You require it to breathe, operate a vehicle, enjoy a meal, produce a work of art, and participate in daily activities. The brain, in short, controls your body's fundamental processes, allows you to process and react to everything you experience, and molds your thoughts, emotions, and behavior. The brain is made up of numerous components that all function as a unit. Different areas of the brain are in charge of coordinating and carrying out particular tasks. Drugs have the power to change crucial brain regions required for vital processes and can be the catalyst for compulsive drug use that characterizes addiction. Brain areas affected by drug abuse include the brainstem, which controls basic functions critical to life such as heart rate, breathing, and sleeping. The cerebral cortex. The cerebral cortex has sections that manage particular functions. Our ability to see, feel, hear, and taste is made possible by many areas that process information from our senses. Our ability to think, plan, solve problems, and make decisions is controlled by the front part of the cortex, also known as the forebrain or frontal cortex, which is located in the front of the cortex. And the limbic system. It houses the reward circuit in the brain. It connects a number of brain regions that manage and regulate our capacity for pleasure. Pleasure drives us to repeat actions that are essential to our survival. Healthy, life-sustaining behaviors like eating and interacting with others activate the limbic system. But abuse-related chemicals can also do the same. The limbic system also controls how we experience other emotions, both good and bad, which helps to explain why many medicines have mood-altering effects. Let us now discuss the way drugs work in the brain. Drugs are molecules that interfere with how neurons usually transmit, receive, and process information by gaining access to the brain's communication system. Because some drugs' molecular structures resemble those of natural neurotransmitters such as heroin and marijuana, they can activate neurons. Due to their structural similarity, the medicines can adhere to and stimulate the neurons by tricking the receptors. Despite the fact that these pharmaceuticals imitate the brain's natural chemicals, they don't activate neurons in the same manner that a natural neurotransmitter does, which results in the network's transmission of abnormal messages. Other substances such as cocaine or amphetamine can inhibit the normal recycling of these brain chemicals or cause the neurons to emit unusually high levels of natural neurotransmitters. This disruption produces a greatly amplified message, ultimately disrupting communication channels. Now let us talk about another aspect, which is the way drugs work in the brain to produce pleasure. The majority of addictive substances work by flooding the brain's reward system with dopamine. In the parts of the brain that control movement, emotion, motivation, and pleasure, dopamine is a transmitter. This system encourages and rewards our natural behaviors when it is functioning normally. However, overstimulating the body with drugs results in euphoric sensations that significantly encourage drug use behavior and educate users to repeat it. A question arises, which is, how does stimulation of the brain's pleasure circuit teach us to keep taking drugs? By connecting life-sustaining tasks with pleasure or reward, Our brains are programmed to make sure we repeat them. Every time this reward circuit is engaged, the brain detects an important event that has to be remembered and trains us to repeat the action repeatedly without thinking. We learn to abuse drugs in the same manner because they stimulate the same circuit. Now we'll talk about drugs as being more addictive than natural rewards. Some addictive substances have the ability to release 2 to 10 times as much dopamine as normal rewards like eating and sex. When drugs are smoked or injected, for example, this can happen practically instantly and the effects can endure far longer than those brought on by natural rewards. The subsequent impacts or the pleasure circuit in the brain outweigh those brought on by naturally rewarding behaviors. People who receive such a potent incentive are very motivated to use drugs again. Because of this, some scientists assert that abusing drugs is something we learn to do exceptionally effectively. Now, let me bring your attention to another objective of my topic, which is addiction and health. Let's first discuss medical consequences of drug addiction. Addicts frequently have one or more additional medical conditions such as lung or cardiovascular illness, stroke, cancer, or mental disorders. Blood tests, chest x-rays, and imaging scans all demonstrate the detrimental effects of chronic drug usage throughout the body. Tobacco smoke, for instance, has been linked to cancers of the mouth, throat, larynx, blood, lungs, stomach, pancreas, kidney, bladder, and cervix, according to a study. Inhalants are one example of a substance that is toxic to nerve cells and can harm or kill them in the brain or peripheral nervous system. There is a relation between drug abuse and mental disorders. Mental illness and drug abuse frequently coexist. Some mental illnesses such as anxiety, depression, or schizophrenia may precede addiction. In other situations, drug usage may cause or intensify those illnesses, especially in those who are already vulnerable. Let us now discuss some harmful consequences of addiction on other people. Beyond the harmful consequences for the person with the addiction, drug abuse can cause serious health problems for others. Three of the more devastating and troubling consequences of addiction are: the first is negative effects of prenatal drug exposure on infants and children. Neonatal abstinence syndrome, often known as NAS, can develop in a baby whose mother misused heroin or prescription opioids while she was pregnant. Additionally, it is likely that some drug-exposed kids will require extra aid in the classroom to make up for any potential developmental impairments in conduct, attention, and reasoning. Current studies are looking into whether developmental issues can occur in adolescents as a result of prenatal drug exposure's impact on the brain and behavior. The second is negative effects of secondhand smoke. Environmental tobacco smoke, commonly known as secondhand smoke, is a substantial source of exposure to a variety of chemicals that are known to be harmful to human health, especially in youngsters. The health consequences of involuntary exposure to tobacco smoke, a 2006 report from the Surgeon General, states that unintentional exposure to secondhand smoke raises the risks of heart disease and lung cancer in non-smokers by 25 to 30% and 20 to 30% respectively. And the third is increased spread of infectious diseases. Currently, heroin, cocaine, and methamphetamine injections are the causes of roughly 12% of new AIDS diagnoses. Hepatitis C is a dangerous, perhaps fatal liver disease that is spread mostly through the use of injection drugs. Drug usage does not only contribute to the spread of infectious diseases through the use of injection drugs. All addictive substances produce some level of drunkenness, which clouds judgment and makes dangerous sexual conduct more likely. As a result, hepatitis B and C, HIV, AIDS, and other sexually transmitted illnesses are disseminated more widely. Let us move forward to last objective of today's topic, which is treatment and recovery of addiction. The addiction can be treated. Evidence-based therapies that assist people in quitting drug abuse and resuming productive lives have been developed as a result of research into the science of addiction and the treatments of substance use disorders. Addiction can be successfully managed, but not always, just like other chronic conditions. Treatment enables individuals to reclaim control of their lives by overcoming the addiction's strong disruptive effects on the brain and behavior. Let us discuss the role of medications in treating drug addiction. Different types of medications may be useful at different stages of treatment to help a patient stop abusing drugs, stay in treatment, and avoid relapse. During the stage of treating withdrawal, patients may experience a range of physical and psychological symptoms when they stop using medications for the first time, including anxiety, sadness, and other mood disorders, as well as restlessness or sleeplessness. Certain treatment drugs are made to lessen these effects, which makes quitting drugs simpler. Second stage is staying in treatment. To assist the brain gradually adjust to the absence of the abused drug, other therapy drugs are employed. These drugs work gradually to reduce drug cravings and have a relaxing effect on bodily functions. Patients who are receiving pharmacological treatment can benefit from their focus on counseling and other psychotherapies. And the last is preventing relapse. Science has shown that the most typical relapse triggers include stress, exposure to drugs, and clues associated with the drug experience, such as people, places, objects, and moods. To aid patients in maintaining their recovery, medications are being developed to interfere with these triggers. That brings us to the end of this topic. Thanks for watching.